Hey everybody, really important aspect here, how to know it's not Hallux limitus. So there's a few different other concerns that it could be, and we're going to go through those. First up is Hallux valgus or bunion deformities, and basically we're going to know it's Hallux valgus or bunions because there's going to be a really large dorsomedial bump. There's going to be on x-rays a little bit more of a increased intermetatarsal angle, or that big toe is going to be coming across, which is increased Hallux valgus angle, and so that's going to give us a really good idea. Whereas with Hallux limitus, it's otherwise going to be a pretty plain x-ray, maybe with a little bit of osteophytes. When there's more osteophytes and there's less range of motion through that big toe joint, that's where we're looking towards Hallux rigidus. And really making sure that we diagnose between the two is going to be a big thing as to whether we're wanting to maintain the motion, such as in Hallux limitus, or where we're wanting to potentially stop the motion, such as in Hallux rigidus. Now, there's other concerns that may be escalating and increasing the progression of this type of condition, and one of those is gout or an inflammatory arthritis. And with gout, we're going to see a lot more rapid progression and deformity. We may see some cysts, but doing our pathology tests around that to make sure that we're in the right spot and not missing anything is important. But if that joint comes through and it's red hot, swollen, causing a lot of pain, then potentially consider whether your differential diagnosis could be that it is gout. Similarly, if there is pain around sort of soft touch or upon a Tinel's testing to that dorsomedial aspect of the first metatarsal, it could be a Joplin's neuroma. And with that, we're really wanting to see, what we will see when we're sort of percussing that area is that there's going to be a bit of tingling or sharp shooting, and there may be even some numbness of the hallux, the medial hallux, and that's going to be very classic or telltale for the Joplin's neuroma. Now, one of our other conditions that it could be that there's a plantar plate pathology or a turf toe injury, and these sort of things are going to be very easily assessed by just doing a dorsal draw of that hallux on the first MTPJ or big toe joint, and then directly palpating into that plantar joint to make sure that that plantar plate is intact. If it's painful, then it's likely that there may be some plantar plate pathology going on there. Similarly, when we're in that area underneath the big toe joint, just having a palpate on our sesamoids, our medial and our lateral, is really going to give us an idea as to whether there might be some sesamoiditis or sesamoidopathy, and exclude that or include that into what we may be treating and how we may be treating. But these are just a few differentials or other conditions that it could be, and these may be with Hallux limitus or it may be instead of. And so getting a full picture of what the diagnosis is will allow you to put a more effective and appropriate management plan into place. But for the moment, this is how to know it's not Hallux limitus, and we'll see you in the next session. But feel free to subscribe, check out some of our other videos, and we'll see you there. Cheers.